Okay, hi everyone, welcome to the last lecture for this semester. Yay, we made it. So today we are going to discuss the genitorial tract infections. So the first, today's whole lecture will be about UTIs. So we will only talk specifically about UTIs and their impact on our health, and also some of the children that are being given birth by people who have been infected by UTIs. So the first UTI on our list is cystitis, basically infection of the bladder. And then okay, let me see if it's recording. Yep, it's recording. Okay. And then what you experience is you also have some pain in your pubic area and you have frequent urge to urinate. And you might also have a cloudy urine or blood in your urine. So just to point it out clear, this is your bladder and this is where you have your infection. Next on our list is pylon pyelonephritis, and it's just basically an infection of your kidney. Symptoms of cyst with black pain and also high fever can result in permanent damage to your kidneys. Next on our list is urethritis, which is infection limited only to your urethra, which is this organ. This can be caused by E. coli. About 80% of UTIs are caused by E. coli. And this is not same strain of E. coli that caused the diarrhea disease that we have discussed in our previous lecture. These strains are of the UPEC strains. So they have adhesion molecules that help them to attach to your urinary epithelium. So basically, they have motility advantage that allow them to travel along your mucosal surfaces. So you know E. coli belongs to your GI tract. So now this is your GI tract, specifically your rectum, and you have the E. coli moves and just gets into your bladder, which is not supposed to be present there. And in some cases, they also goes into your urethra and into your sexual organs, which is also not supposed to, which is not also not their native form. Naturally, the body flushes the E. coli out, and you'll be fine. But in some cases, you still have some stubborn E. coli's, which have stronger adhesion proteins, which help them stick more. So transmission is through your GI tract to your urinary system, as I just explained, and sometimes through catheters when someone gets sick and they have to insert catheters to their private part. Next on our list is vaginitis, and which is basically inflammation of your vagina, and is characterized by vaginal itchiness, burning, and also discharge. This is caused by Candida albicans, which is yeast, and also Trichomonas vaginalis. So now let's go ahead and discuss um, how each pathogen causes this. First one on our list is the yeast, which is Candida albicans. It's a yeast infection. This is a dimorphic fungus, and then it's a normal microbiota, which is present in 50 to 100% of humans, present in oral, GI tract, and in the vagina. When we get if they grow uncontrollably, they contribute to this vaginitis, and what you experience is a discharge which might be white or curd-like. Transmission is to be is There's no transmission for this because they're opportunistic pathogens due to their disruption of the normal biota. So they are just there. If they just grow uncontrollably, they just destroy the normal biota and cause infection. Next on our list is Trichomonas vaginalis, which is a small pear-shaped protozoa. It's also a normal microbiota in some people, and in many cases, it's asymptomatic. Men's normally don't have this. So in females, you see discharges, and your discharge can be white to green frothy. And then transmission is mostly through STI, so it have to be sexual direct contact because it's an STI. So non-inflammatory infections of the vagina include the one which is caused by bacterial vaginosis, and symptoms include you not having not soreness and also irritation. You also have discharge, which can be thin white with some fishy odor, and you might also have itching sometimes, and can lead to PID, infertility, and ectopic pregnancy if it's left being untreated. This is very common in women in childbearing age, so you guys have to be careful out there. It's caused by mixed infection, but it's caused by mixed infection, which is a bacteria, which leads to bacteria diabiosis, dysbiosis. So there's no common set of microbes that are known to cause this. They are mostly anaerobic. Example of such microbes present causing this include the Gardnerella vaginalis, Autopibium, and also Mobiloncus. Transmission is basically they being opportunistic pathogen, but most likely might also result of reduction of lactobacillus in your vagina. So now let's get an overview of vaginosis. So the first one is bacterial vaginosis, which is caused by overgrowth of bacteria naturally found in your vagina. And then if left untreated, or some of the symptoms include fishy odor down there, and you might also have thin milky white or gray discharge, and sometimes you might have itchiness, and basically you have an uprising of increased pH down there. And the ones with yeast infections, which causes vaginitis, you have overgrown fungus down there, and then there's no odor, but you experience a thick white and also cottage or cheese-like discharge. Usually you have itchiness or burning down there, but it doesn't increase your pH. Next on our list, or the other one is trichomoniasis, which is sexually transmitted in your private part by a parasite, and it's caused by a parasite, and or you usually have a musty or unpleasant smell, and you also have frosty or yellowish to greenish discharge. Sometimes you might have itchy or burning or irritation down there, and then you obviously also have an increased pH. So now that we've discussed that, let's switch gears and talk about prostatitis or prostatitis, which is basically inflammation of your prostate gland, and it can be acute or chronic. It's caused by opportunistic pathogens, basically basically having them moving from the GI tract um, and moving into your urinary. Sorry, sorry. These are opportunities pathogens that will move from your GI tract into your urinary tract, and they get localized within your prostate and cause more diseases and cause more problems. Some symptoms include pain in your groin and lower back, and you have frequent urge to urinate because your prostate is obviously super enlarged. And sometimes you might have difficulties in urinating because your prostate is enlarged, but the frequent urination will come from um, the whole pressure being put within your bladder for you to kind of urinate frequently. In some cases, you might have blood in your urine and also have painful ejaculation in men. We also have some genital discharge and genital ulcer diseases, which is being seen in your urinary tract infections. So the first one is genital discharge disease, which will include gonorrhea, chlamydia, and then we gonorrhea and chlamydia, and then we also have genital ulcer disease, which includes syphilis, chancroid, and also herpes. So now let's take each one after the other. First on our list is gonorrhea. And gonorrhea is basically A genital discharge disease is caused by Neisseria gonorrhea, which is a gram-negative diplococcus bacteria. It have a fimbriae which attaches to your mucosa epithelia. It have a phase variation and confuses the immune system, so it's very easy for it to evade your immune system. In 2011, there was a strain in Japan which was found to be resistant to all common used antibiotics. Transmission is through vertical and also direct contact, which is through STI, so you have to be careful out there. Symptoms in males include you having urethritis, painful urination, yellowish discharge, and about 10% of these cases are symptomatic. In females, you have mucopurulent and also bloody vaginal discharge, have painful in when you want to urinate, you experience severe pain, and about 50% of these cases is also asymptomatic. In some females, you have inflammation of your fallopian tube. As you can see from here, you have some inflammation, and you might also have pelvic inflammatory disease also present too. And children born to gonococcus carriers can be infected as they pass through the birth canal. And when they get infected, this mostly results in them having eye infections, which can also result in blindness. An example is what we see in this image below. Next on our list is chlamydia, which is also a genital discharge disease. It's very most common, it's one of the most common repeatable infections here in the US, and it's more like a co-infection which comes in common with common gonorrhea. And then it's caused by chlamydia. It's caused by chlamydia trachomatis. This is a very small gram-negative bacterium, and it's an obligate intracellular parasite. It's also transmitted through STI and is also vertically transmitted. Symptoms in males include discharge, painful urination, sometimes you experience it as asymptomatic. In female, you have cervicitis, cervicitis, and then you have discharge. You also have PID, and you have up to 75% asymptomatic symptoms. And then infant who pass through the birth canal might be infected and they might have eye infections and in some cases pneumonia. Next on our list is syphilis, which is basically genital ulcer disease. There are several stages. The first one is the primary syphilis, which is a cancer, basically a small red hard bomb that appears at the side of entry, and one of it is being seen here. Have the secondary one, which is more of a 3 to 6 months, which appears 3 to 6 months later on. This is more intense and it's also systemic. And you patients might experience fever, headache, sore throat, and red or brown rash on palms and also on their soles, as we can see in here. The third one is latent and tertiary syphilis, which happens in about 30% of syphilis cases. It causes damage to your small arteries and also your outer walls. Have gammas develop in your liver, skin, bone, and cartilage. And you also have neurosyphilis, which is basically you having headache, you experience convulsion, atrophy of the optic nerve, blindness, and also dementia if left untreated. Uh, this is not transmissible. And then we also have the last type, which is basically congenital syphilis. What it does is it inhibits fetal growth and disrupts critical period of development. This causes fetal abnormalities, spontaneous miscarriages, and also stillbirth. So, if you ever experience syphilis in your lifetime, please try and get treated because it's not only going to affect you, but it might affect your offspring if you are pregnant. Syphilis is caused by Pretominum pallium, which is a saprophyte gram-negative microorganism or bacteria, binds to the epithelial cells by its hook tip. So now this is the host cell, and then the syphilis organism binds to it using its hook tip. It's definitely an STI and transmitted vertically. Risk of infection is more like a 12 to 30% per a sexual encounter. So you have to be careful who you have a sexual encounter with. Next on our list is chancroid, which is a genital ulcer disease category, which is in the that disease category. It's caused by Haemophilus ducreyi, which is a pleomorphic gram-negative rod. Symptoms include there is a forms of soft chancre, which is painful in men and often unnoticed in women. And one of the chancre can be seen on someone's penis, as we can see here. It's very common in the tropics and also in the subtropics. It's transmitted through STI and it's not vertical. Next on our list is genital herpes, which is also a genital ulcer disease. This is caused by herpes simplex virus 1 and 2 or HSV 1 and 2. Transmission is through STI and also is done vertically. Symptoms include single and multiple vesicles on the genitalia. As we can clearly see here, this guy have more than one of the vesicles on his genitalia. And then it can also be present in your thighs and also in your buttocks. You might also have vesicles filled with clear fluid, which is very painful to touch, and as it can be seen on someone's mouth and then someone's lips. And then you also have recurrent episode of lesions, which occur due to viral latency. If the pregnant mom have it and give birth to a child, if the child pass through the birth canal and get infected, the child might also experience neonatal herpes simplex. Um, Infections can be present in the mouth, skin, and eyes of the infant, and in some cases have 30% mortality rate. There will be increase of infections of the CNS, which will also lead to 50 to 80% mortality rate. Um, In some cases, you have the virus which causes this disease becoming latent and reactivating back few moments or few months later on. This virus become latent in the ganglion of your lumbosacral spine nerve tract. So basically, this is a female body, and then the virus try to hide itself, and then basically you might see this as later on when they reactivate, you might see this as lesions which are caused by the HPV right behind the skin, and then reactivation can be done. Um, through UV, injury, menstruation, and other infections. So the virus can just be reactivated anytime and it comes back again, you experiencing another phase of herpes. This is all I have for you today. Please try and prepare nicely for your exam, and I wish you good luck in your exam. Okay. See you on Friday. Bye.